Assalamu alaikum, everyone. I am Dr. Soraiya Baksh, and good evening to everyone watching tonight. I am honored to be invited to be part of the celebration for IBN's program 20th anniversary and for their Doctor in the House series. Today, we will be discussing breast cancer awareness, as October is Breast Cancer Awareness Month. I am an emergency physician based with Southwest Regional Health Authority at Princestown in the emergency department, and I have been working in the emergency department for the past 17 years. And I welcome you all tonight. So tonight, the topic being breast cancer. It is a very common issue that we ignore as women. And it is an important topic to be discussed amongst women, even though some may be uncomfortable with speaking about it. Your personal healthcare provider will also be very informative with any information that you would want. And also, we in the emergency department also meet people who would have issues with their breasts that they need to discuss with us as well. Breast cancer is an important topic. Breast health is an important topic. Women's health is also breast cancer is part of women's health, and we need to pay attention to women's health more often. So in the event where you come into your doctor's office and you have a complaint about your breast, what would you look forward for with your doctor? Your doctor will firstly take an extensive history from you, and which would include your past medical history, surgical history, your personal gynecological history as well, whether you have allergies, whether you're on medication, your age group, your family history. All these topics are important to cover with your doctor. Breast cancer occurs in women who are more at risk, and risk factors would include whether the amount of pregnancy you may have had, pregnancies, whether you were breastfeeding, the type of breast tissue you have, if you are on hormone replacement therapy, birth control, if you're a smoker, and your alcohol intake as well. At your doctor's office, what you would expect as well is to be examined. And this would mean that you would have to be examined by your healthcare provider. There's also something called self-examinations, where women need to be aware of their own type of breast tissue and what is normal for them and what is abnormal. So complaints that you would present with can be if there's any pain, if there's any swelling, if there's any abnormality where you would pick up in the size of the breast, if there is any lumps. There can be lumps that you are able to palpate, and you may not be able to pick up lumps as well. Also, if there's lymph nodes that you would pick up on examination as well. And this can be done at home when you learn to have self-examinations at home for women and also for men, but we'll strictly stick with women for now. And it will help decipher what is abnormal and normal for you. At the doctor's office, after an examination is done, they usually recommend having an ultrasound and a mammogram done. These are different types of tests that need to confirm whether there's anything abnormal in the breast. For most women, these procedures are uncomfortable. Usually you get used to having it done routinely every year. And it gets more comfortable with time. And a lot of instances where women are uncomfortable, the healthcare provider usually tries to reassure you and lets you know that all this is part of the normal process. In terms of your family history, when speaking to your healthcare provider, you must include whether you have any relatives, close relatives, primary relatives, siblings, parents, children that may have had some sort of breast issue or a history of breast cancer. If you are on any type of hormone replacement or birth control as well is important. Breast cancer screening is done yearly. And once it's normal, you can increase it to every 2 to 3 years. Routinely, for a routine checkup. And there are different risk factors where having a normal cycle, meaning a menstrual cycle, there are times during that cycle where you would feel abnormalities within the breast, but they can be normal on examination, and it has to do with your hormone cycle. And when there is any skin changes that you would pick up, such as irritation of the skin, redness, flaking of the skin, that is something of concern that you should see your healthcare provider for. And if there is any changes in terms of dimpling of the skin, puckering of the skin, color of the skin changes as well, is also an important observation to take note of to see your healthcare provider. Also, if there's any strange discharges from the nipple itself, that is not milk, meaning blood, a bloody discharge, blood in itself, or just an abnormal colored discharge from the nipple is something that you need to pay attention to as a woman. And it helps when you don't ignore these symptoms that may or may not develop. So in terms of looking at changes within your system, it is important so that you can observe what is normal and abnormal, so that you don't ignore symptoms when it occurs. When you speak to your doctor, you must also include whether you are on medications that can affect you. And if that is a risk factor, and if you're smoking, or if there's a large consumption of alcohol in your diet as well. Physical activity lowers your risk of having breast cancer, and maintaining a healthy diet and maintaining a healthy lifestyle in general. And it improves your livelihood. Questions that you may want to ask is the importance of having a mammogram, or what is a mammogram? A mammogram is a special x-ray that is done for breast tissue in order to pick up any abnormalities. There is a screening mammogram done, and there's also something called a diagnostic mammogram, which is a more detailed x-ray of the breast tissue. There are different types of tissues within the breast, and this would include fibrous tissue, glandular tissue, and fatty tissue. Every woman has a different type of normal breast tissue. it's more, most women can have more of a fatty breast tissue. Some may have scattered fibrous tissue within them. Some may have more fibrous tissue than fatty tissue, and then some may have, the majority, more fibrous and glandular tissue. The more dense breast tissue is present, which is when there's more fibrous and glandular tissue, there's a higher risk of developing breast cancer. And that being said, in a mammogram, it's picked up as white opacities, the glandular and fibrous breast tissue, which can hide evidence of having very small signs of breast cancer. And in cases like these, we would have to go on to using ultrasound and to detect anything further. So the importance of having the mammogram done is, one, detecting what is normal breast tissue and what is normal for you as an individual, and then if there's any abnormal changes that occurs consequently year after year when you routinely do this screening. Another type of screening test that is done that helps is ultrasound. And ultrasound picks up fibrocystic and cystic tissue within the breast. Usually, in the beginning, all these tests are done together in terms of the examination, mammogram, and the ultrasound in order to make a full diagnosis of having no abnormal breast tissue. And it is important to do so. It correlates with each other in terms of having your examination complete. And it picks up signs early when it is routinely done. So women in general also need to learn to do self-breast examinations at home on a monthly basis to be able to pick up any abnormalities within themselves. As I said before, every woman has a different type of breast tissue, and they need to be able to identify within themselves what is normal for them. And it is a very sensitive topic in general, and it is something that should be made aware to the general public, and to make young girls growing up be aware of the importance of this topic as well. Women's health is a broad category, and it would also include other types of factors: ovarian cancer, cervical cancer, perimenopause, menopause, healthy exercise, healthy diets, healthy lifestyle habits. And together, being informed of this has better outcomes for everyone. In general, having to visit the doctor in itself is a very nerve-wracking experience for most individuals. And in order to be able to open up and explore what issues you are having, you have to have a good relationship with your doctor. And it helps when you are able to be able to converse freely and have that time with your doctor to develop that relationship where you can establish trust. And it helps for you to be able to be compliant with your own care and your own follow-up management as well. This being said, it will be beneficial from educating girls at a young age of the importance of having a relationship with a healthcare provider, with their parents. And it is important for them to develop this relationship. In terms of follow-up, it is, even though you may have normal visits in the beginning, it is not a deterrent to stay away from having yearly doctor visits to make sure everything is on the up and up. And it helps with your peace of mind as well. And early detection. Early detection is always important because it is treatable. So in terms when we speak about the different types of breast tissue, we have to pay attention to the type of care we need for them for treatment of any abnormality within the breast. And we will continue this after we come back from our break. So see you soon.
A meeting of friends, a familiar place, the first sip of something special, a moment of connection, a journey into nature, the sound of flowing water, the warmth of the sun, laughter, friendship, and a taste as bright as the moment. A bond between father and son, lessons passed down, memories created. The cool touch of the river, the crackle of a fresh drink. Moments like these are what stay with us forever. A sip of serenity, refreshing and pure, the gentle rustle of leaves. A push beyond limits, strength in motion, every step, every heartbeat, every challenge met with unstoppable power inside. The fuel to go further, to push harder, to be more. The grind, the focus, and at the end of the day, we come together. A table full of flavors, a room filled with laughter, a night of stories and memories. Different tastes, different moments, but one feeling. Because the best things in life aren't just tasted, they're shared. Taste Sultan drinks now. You know what you drink.
Hi, I am Bibi Ajuda, host of The Right Fit. Join me every Monday at 8 p.m. on The Right Fit on IBN, driven by the Dean.
Assalamu alaikum and welcome back to Doctor in the House. We are continuing our topic on breast cancer and the different types of breast tissue within the breast. And what we're going to focus on there is what the different types of breast tissue do. So lobules and the glandular tissue within the breast are the tissues that produce and carry the milk. It also involves the breast ducts as well that go towards the nipple area. And the connective tissue of the breast is what holds the breast together and gives it its shape, which includes fibrous tissue and fatty tissue. And why are we talking about the tissue itself is where actual breast health would include caring and using proper breast support where the type of undergarments you wear help support and protect your breast from pain and irritation and damage, further damage, especially depending on the type of activity that you do. So if you're a very physically active person, you need to note the type of undergarments you wear in order to protect your breast tissue from any damage. So as I said, breast support is also a major factor when it comes to breast health. There are other factors with the type of perfumes and deodorants that people may choose. Everybody has a personal liking, and doing a bit of research on how it affects your skin and how it's penetrative within your skin is also something everyone should look into. I won't go into personal details of what I prefer. Everybody has their preference. And doing your own research on what works for you is good enough. And in that way, you would learn what works well for your skin, your underarms, and your breast area. So why we are speaking about breast tissue is breast cancer in itself is where cells within the breast grow abnormally out of control. And one question that may come about is if it can happen to both breasts, which it can. It may not happen at the same time, but it can occur in both breasts, as both breasts would have similar breast tissue within that individual. And breast cancer can also develop within the ducts of the breast or the glands of the breast, which is the actual breast tissue in itself. And it can spread through the blood vessels and the lymph nodes of the breast. So some of the first signs people can pick up on is sometimes not actually a lump within the breast, but a lump under the arm, which is a concern because then the lymph nodes become involved there. And it may not mean that the lymph node is cancerous. It can mean there's an infection, but either way, it has to be properly examined and checked. In women 40 years and over, it is recommended strongly to have breast cancer screening at least every 2 years as a routine screening in order to pick up on early detection of breast cancer or any abnormality within the breast tissue. And in doing so, you learn the type of breast tissue you have from the beginning and if there's any changes consequently. Because your mammograms are not just done and thrown away. It is used to be able to compare previous reports that was done in years previously. So if you are doing your first mammogram at the age of 40 and then your second and third at the age of, say, 41 and 42, everything is compared to the previous ones in order to detect any changes. And that is why it is important to keep all your medical records safely in order to take it to your healthcare provider. If you are sticking to one healthcare provider each time, then it is easier for them to have your records for them to compare in order to pick up any abnormalities. Now, there are different types of breast cancers. The most common type is one called invasive ductal carcinoma, where it starts in the ducts of the breast tissue. And it is the most prevalent type, occurring in 70 to 80% of cases of persons diagnosed with breast cancer. And the second type that is the second most prevalent is invasive lobular carcinoma, which occurs in 10 to 15% of cases within the glandular or the lobular tissue of the breast. There are subtypes of breast cancers where they look for specific receptors on the breast tissue that decipher the type of breast cancer that also would have to be treated, where they would look for estrogen receptors, progesterone receptors, and human epidermal growth factor receptor. And having these receptors present in breast tissue would affect the type of treatment that you get. There are other less prevalent cases where there is something called inflammatory breast cancer and Paget's disease of the breast. These two cases, even though it occurs less, it presents differently from classical findings of having a breast lump on examination, where it actually affects the skin and the size of the breast and the color of the breast. So you may develop tenderness on parts of the breast, warmth, redness, and then which can also be an indicator, as I said, of infection or hormonal changes. And then there's Paget's disease of the breast, where you have irritation, flakiness, redness of the skin, especially around the nipple. That is a chronic problem, and it's not going away. It also can present the same way like dermatitis and eczema of the breast. So the only way to decipher the differences is to have the examination and the mammograms done to be able to pick up on any early changes. And these different types overlap in symptoms, and it is easy to just think it's hormonal and it might go away. Or it might just be your dry skin and it will go away. Or it might just be a temporary inflamed area due to, as I said before, the type of undergarments you wear and the type of activity, physical activity you would have daily, and it might just go away. But the longer it stays untreated and unnoticed and ignored, the outcome tends to be more concerning. And it is important to seek advice from your healthcare provider. And in these cases, where symptoms occur, you need to not ignore them. So for newcomers who never heard of having to examine your breast and look out for symptoms, you look for a new breast lump that you've never felt before, especially any area around the breast or around the nipple or under the arm. If there is a feeling of the skin being thickened or swollen in a particular area that never happened before, discoloration of the skin that never happened before, changes in the texture of the skin is also important to pay attention to. Any irritation or dimpling of the skin that actually occurs, it can be painless as well, that you never noticed before. So it is actually very important for a woman to pay attention to the skin on the breast itself and know what is their normal and what is abnormal for them. As I mentioned before, redness or flaky skin, if that is noticeable and not going away with simple moisturizers, is something you should have examined. Pulling in or puckering of the nipple area or the areola area around the nipple is also very important to pay attention to. Any abnormal changes in the size or shape or color of the breast on the skin. And if there's the presence of abnormal pain, regardless of your menstrual cycle. Because prior to your menstrual cycle and during your menstrual cycle, you have normal changes within your breast tissue that most women are aware of because of having the cycle and paying attention to it. But any abnormality that you've never seen before is something that you must take note of and come to your healthcare provider for. There's a big predisposition as well with your having the gene for breast cancer. And we may take it for granted that somebody in the family had cancer, whether it's ovarian cancer or cervical cancer, colon cancer, and not think it may affect the females in the family having a risk of having breast cancer. So it is important to pay attention to your primary relatives, as I said, parents, siblings, children, who may have developed some form of cancer and its predisposition within the family. There is something called genetic testing that can be done for breast cancer. And it may or may not be available in certain areas, and it is good to question and be able to find out information further about that. When you are having your mammogram done, it is usually done by a person trained in doing mammograms. That person may not be able to read the x-rays from a mammogram, but they are capable of performing the procedure. And for those who are unaware, mammograms are done with machines that either have metal or clear plastic surfaces where your breast tissue has to be flattened in order to get a clear picture of the tissue within. And it is done in a standing position, and it is done in more than one planes where it is either vertically or horizontally flattened in order to get more than one view of the breast tissue. And on the days of these appointments, it is important for women to note that the type of clothing you wear is important, because you would have to expose your chest area completely for the examination. And so instead of wearing probably a dress, you'll be able to wear a pants and a top that you'll be able to remove. And they would provide you with a gown where they would only expose the area that needs to be exposed during the testing at that time, because a mammogram would be done on both breasts. And it is also important to know that you do not wear deodorant, perfumes, or any special powders during that time, because those can be picked up as artifacts within an X-ray, which comes up as white specks, I should say, within the X-ray, and can give you false interpretation of X-rays as well. And if your mammogram is normal, as I said, follow-up mammograms are compared to your previous ones. And if it is abnormal in event, you are usually referred to a breast specialist for them to diagnose any further issues with further tests, which would also include having an ultrasound done. And depending on the type of the type of issue that is brought about from the mammogram, MRI might also be required. But your breast specialist will determine what investigations needs to be done further in order to diagnose the issue. And not all results mean cancer. So it is good to have more than one investigations done in order to confirm what results is shown in the mammogram. And in terms of therapy, if there is an event where breast cancer is detected, there are different types of management that is explained to the patient, most of which is surgical is one type of treatment where you remove the cancer in itself. There's also chemotherapy, radiation therapy, and hormone therapy. So in the type of cancer detected and the type of spread that is detected, then the type of treatment will be aligned with that. And the breast specialist will come up with a management plan for the individual patient depending on the type of breast tissue, the type of cancer, and the type of spread that is done from the breast cancer. Most of the time, from early detection, very early detection, the breast tissue that is affected is the part that is actually removed. And it does not necessarily mean that the structure of the breast tissue is affected. And also, when there's spread within the breast tissue, there's also instances where patients would have to have the entire breast removed. And but this is also discussed with your healthcare provider and the breast specialist to be able to continue management. Another question that occurs is if breast cancer can occur in men. And it can. There are instances where breast cancer has occurred in men, and it is usually the ductal, invasive ductal type carcinoma that occurs, and it also has the same treatment for them as well, where it has to be removed, and they also have to go through chemotherapy and radiation therapy. There are support groups present that can be found on social media and within religious groups as well for persons who develop different types of cancers. And in this, it is good to share your experiences with others to show support. It is taken for granted that everyone who has breast issues has the possibility of developing breast cancer, but that's not so, because you can have breast issues that have nothing to do with cancer, but the only way it can be detected is, as I said, routine examinations and routine screening tests. And it can help with further care and with maintaining a healthy lifestyle. So another factor that is taken for granted is the type of lifestyle that you practice, where proper healthy eating, proper physical, not proper, I shouldn't say, regular exercise, maintaining a healthy diet, and maintaining a healthy weight are factors where you need in order to prevent your risk of developing any type of chronic diseases, cancers, and these are simple habits that is taken for granted by everyone. There is having the type of foods you eat is important, where increase in fruits and vegetables, your protein intake, the type of carbohydrates you take in, processed foods play a factor in your healthy lifestyle, on your routine. And your daily physical activity, where you develop a habit of maintaining a certain amount of cardio exercises, strength training exercises, help maintain healthy lifestyle as well. And also in turn helps maintain a healthy weight. And this affects your outcome of developing chronic diseases to a lesser extent. And another factor is family history. So if there is a strong family history of diabetes, high blood pressure, obesity, ischemic heart disease, familial cancers, these are factors that should motivate you into practicing healthy lifestyles in order to prevent, or if not prevent, delay the occurrence of these diseases from developing. It is something that we as individuals need to take into account daily and not put it on the wayside. And smoking is also a factor, and the amount of alcohol consumption. As Muslims, we don't drink alcohol, but it's also a factor that needs to be included. And when there is a lack of motivation within oneself, you tend to not think of these factors as being influential in your body's processes. And it is something that we need to pay attention to. It is very, especially when you have to pay attention to your family and set an example for younger adults, younger children within the family as well. When they see an adult practicing healthy practices, they realize taking care of themselves is important as well. So they see the way you eat, the way you exercise, the way you control whether you smoke or you drink alcohol, or what medications you may be on, or actually going for your doctor visits, your dental visits, your checkups. They realize it is an important part of their lifestyle where it is important for them to take care of themselves as they grow up older. And when they are informed at an early age, they become more educated in their decisions that they make as an adult to be able to take care of themselves. And as I said, breast cancer screening for young adults, young females growing up, being informed of having self-examinations at home, keeping track of their menstrual cycle, their family history. A lot of families tend to not want to share the type of illnesses within the family because it may be taboo or it may be frowned upon. And it is not something to look at in that aspect, because you want the younger generations to be able to know their history so that they will know how to take care of themselves further. So having an awareness of the different types of illnesses within your family that you share with your younger generations is important. Even if it's cancer, even if it's a chronic disease, even if it's a skin condition, even if it's a mental health issue, all that plays a role in their future, where they actually prioritize their health and take care of their future generations to come. And screening for different diseases is important. And it is quite, even though we are focusing on breast cancer, screening across the board is important. For colon cancer, for prostate cancer, for ovarian cancer, for cervical cancer. Those are the most common cancers that occur, and it is important to show them the importance of it. And screening for chronic diseases as well. Screening for diabetes, screening for high blood pressure, having your cholesterol checked is also important. And on this note, I thank you for listening to my information I've divulged, and I hope it is helpful. And I thank you for being part of the show today, for Doctor in the House, and thank you again. See you next time.
Hey kids, my name is Dax, and I am new to Cool Kids team, and my flavor is watermelon. Try one today.